invite Dr. Arif Pasha, Professor in HOD, NRI General and Super Specialty Hospital, Guntur. We're inviting him for the talk of protein targets in critical care.
One second. Yeah. Thank you for your kind words. At the outset, I thank the organizers for giving me this opportunity, especially Dr. Pradeep Rangapal sir as well as Ajit sir, to be here with you at this moment. Yeah. In the next couple of minutes, then 12 to 13 minutes, we'll go through what are the targets of protein in our critically ill patients. So, because even though we have entered into the modern era of critical care, this topic, few concepts like protein targets in critical area or in a still debating condition. In order to have a better idea, we'll go through why we are more worried about these proteins, and we'll just go through the studies which are backing for these protein targets, so which is quite interesting. What exactly is happening in the normal subject? Because when the person is healthy, he used to take around 70 grams of amino acids, which the same is oxidized in the body. And there is a reciprocal exchange of proteolysis as well as proteosynthesis in order to maintain the organ functions. The net balance is, the zero net balance will be there ultimately in a healthy individual. What happening in the critically ill patient? So because of this high catabolic rate, in the severe illness, there is a loss of muscle function, which is mentioned by this slide. There is a decrease in the muscle mass as the patient goes in the ICU as the stays longs. This is the slide which shows that when the patient stays in the ICU for a period of 10 days, there is a decrease in 70% of the lung mass. So what exactly happening in the patients, in our patient? When a patient of severe sepsis or from major surgery or any polytrauma case enter into the ICU, what exactly happening? Sure, what exactly happening is here. So there is increased proteolysis. Because of that, increased amino acids will take place. These amino acids will stimulate the immune cells in order to fight against the inflammatory cells. So this is the study which was shown by Hujuman et al. That the most important thing is when the patient is coming to the ICU, the muscle amount, the muscle quantity which is present in his body is the crucial for getting into the outcome, for predicting the outcome. So this is not only the skeletal muscles, but also this diaphragm. This study shows that as the patient stays in our ICU, there is a decrease in the diameter of 25% and there is a decrease in the contractions of more than 50%, which is causing the delay in our weaning as well as prolonging this patient to stay in ICU. What exactly happening in this? So as this patient is having, they are immobile as well as having a systemic inflammation, there is decreased protein synthesis as well as increased protein degradation as well as causing this anabolic resistance. Because of all this, the added component will be the increasing age. So basically the muscle contraction as well as the protein, they'll be acting as an anabolic stimulant, which are helpful because this anabolic stimulant has been suppressed by this systemic inflammation where taking of proteins will be helpful. So what are guidelines suggesting? So because all the guidelines, if you take the ASPEN, ISPEN, as well as Society of Critical Care Medicine, and also our Indian guidelines, they are suggesting in the critical ill patient 1.5 to 2 grams per kg body weight per day, which is a grade A evidence is there. So yeah, day in and day out, we are going through all these things because whatever we are prescribing the nutrition, the study, this is an excellent study which was done by Helland et al. What they say is, yeah, so it's around whatever you are prescribing, so take about 1.3 grams per kg per day, only 55% of the prescribed form is going to the patient's body. Whatever the reason, because of innocence, burnoutness of the nurses or inadequate knowledge of the person who is treating, whatever the reason, we have to consider that only 55% of the prescribed feed is going inside the body. So in order to have a better understanding, we'll just go through these evidence studies. So we are having the randomized control trial. So one of them is EAT ICU trial, which has been studied, which has been placed in 2017 Intersquare Medicine. And what it says is this is an early growth directed nutrition versus standard of care in adult intensive care unit. They are having 119 patients. out of which two groups, one is high protein group as well as low protein group. For high protein group, they have given 1.5 grams per kg per day, as well as the low protein group, control group is 1.2 grams per kg per day. So here they receive the 25 kilocalories in the control group. Here there is 100% calories getting in the high protein group. Coming to the results, what they found is that all these endpoints, whichever considered, 28 days mortality, 90 days mortality, 6 months mortality, infection rate and mechanical ventilation, as well as the performance score, all are not showing any significance. But what they found here in this is, because of the supplementation of high proteins, there is 100% calories insertion is there, where they felt difficult to maintain, to control the hyperglycemia. The other randomized control trial is, this is a protein requirement in the critically ill patient by using this parental nutrition, which Ferry and et al. From the Australia has done this group. They have studied in 119 patients. They have divided into two groups. High protein received 1.2 grams, as well as low protein receives 0.8 grams per kg per day. So coming to the same, the indicators, the end indicators, there is no significant difference. What they found was, there is the patients who are receiving the high protein diet, they have shown the significant improvement in the muscle mass as well as significant improvement in the hand grip. So, but regarding this difference between the proteins, the authors concluded that the difference is very small. So coming to the other trial, which is a randomized trial where they have used intravenous amino acids for the kidney function in critically ill patient. They have given the 2 grams per kg per day of amino acids infusion. In the intervention group, they have taken 239 patients. In the standard, 235 patients. All the endpoints are again not significant. So coming to the other trials, Ruge et al. Has studied regarding the hyperproteinic as well as hypocaloric diet. They have compared with the isocaloric. They have given the protein in a state of 1.4 grams per kg per day in a high protein group, whereas in low protein group it is 0.76. Here, when comparing this protein taken is significant, but the other two components of endpoints, right, mortality as well as mechanical ventilation, is not significant. Cliffin et al. Has studied the same in head injury patients, where they have taken for 20 traumatic brain injury. They have studied in between high protein and low protein. Here also the results are negative. So till now, the 5 randomized trial comparing this high protein as well as low protein, there is no significant difference between the mortality. So they have done this meta-analysis. Even meta-analysis is not showing any significance change here. The diamond is the central position. So we have completed the randomized control trial. Now we are talking about the observation trial. Regarding this observation trial from 2009 to 2015, the Helland et al. From Canada has done this 4 studies, which shows what they have done here is, they have added 30 grams of protein per day and maintained 1000 calories per day. They have done this for 12 days. What they shows was, there is decrease in the infection as well as decrease in the mechanical ventilation days as well as decrease in the mortality. So presently, the randomized control trials have not showing significance, the meta-analysis not showing significance, but observation studies are showing the favorable outcomes. This is another study which was done by Nicholas et al., which was published in Japan. What they says is clinical outcome related to the protein delivery in critical ill patient. What they have concentrated and what they have concluded is, now we should not concentrate on the calories. We have to concentrate on the protein requirements. What they found was, if the patient receives more than 80% of the targeted energy, then there is an associated lower risk of dying. So coming to is this high protein is deleterious? So this is a study by Christian et al. This is a retrospective study, that protein vent study. So what they have concluded is, that's the timing of protein intake in the clinical outcome. What they have concluded was, if the patient is taking high protein, if the patient is taking in the early period, like 3 days, less than 3 days, it shows an increase in mortality. Whereas if the patient is taking less than 0.8 grams per kg per day, there is increase in 6 months mortality. So now we are in the midway. If you take the high protein in the early days, there is mortality. And if you take the lowest range of protein, there is increased mortality. So we have to be in between. So is it safe to administer high dose of proteins? Yes, they have. Duge et al. Has studied in one of the case, like here given 2.5 grams per kg per day, which is safe in the general ICU except in hypotension and liver disease patient. Here he has given a 2 gram per kg per day amino acids. He has found that there is increase in the GFR as well as improvement in the urine output in the high protein groups. So Now we are waiting for this new case studies like Nexus. What they have done here is it has been started in 2017. Hopefully it has to complete in the last year. Hopefully it might complete in the next year. So what they have done is, this Nexus study is, it is a nutrition and exercise intervention study, because here the patient has been given a supplemented amino acid 2.5 grams per kg per day. Along with that early morning bedside, they have been combined with this cycling ergometry. So they have given the primary outcome as 6-minute walk test, as well as they have significant checked the functions of the muscle strength. The other study is Replenish study, which is a multicentric and international open label randomized control trial. Where they are going to compare, they are comparing this high protein as well as low protein. They are randomizing at the 5th day of the admission. The primary outcome is around 90 days mortality. It's going to complete in 15 December 2022. So in order to conclude, just because presently we are having an inadequate sufficient data to just conclude which amount of target of protein is helpful for the critically ill patient, because one size doesn't fit all. So considering all these studies, we can have an arbitrary phenomena like in acute phase, because coming to the RCTs, they have shown there is no mortality difference. Coming to the meta-analysis, no mortality benefit. Coming to this observation study, they are having favorable outcomes. Okay, and if the patient is receiving in the high protein in the earliest days, he is having high mortality. If the patient is receiving in the lowest protein energy, he is having high mortality. So for that, we can have in the acute phase, we can arbitrarily give the increased protein delivery targeting up to 75%, whereas in post-acute, considered as more than 5 days, up to 100%, we can go 1.3 to 1.5 grams per kg per day. If it is post-ICU target, we can go up to 2 grams per kg per day. Post-hospital discharge, when the patient is in recovery phase, we can go up to, he requires the larger amount of protein, like 2 to 2.5 grams per kg per day. Fortunately, or hopefully, new trials will shed the light on the impact and optimal dose of protein for critically ill patient. So this is our institute, the NRM Medical College, which fortunately I'm working from past 15 years. And while we are enjoying here the yesterday lecture, we got a good news that this is one of the institute which is training DM critical care in the twin cities of Andhra Pradesh, Andhra and Telangana. We got a news that our student Dr. Neeraj has, I'm really happy to share this, that our student Dr. Neeraj has got 73% at the university level. This is because of, along with the academics from the department as well as the institute and the best critical care team, we are having a help from the ISCCM behind, as well as JIX from Bangalore, which is headed by Pradeep Rangapusan, as well as Ajit sir, and the Higgs from the Hyderabad, as well as master classes from the Venkatraman. Thank you. Thank you one and all.
Hello. Thank you, sir.